Okay, we'd like to welcome everybody back. I'd like to give just a little bit of insight on our next wonderful speaker, Nina Abiera. She's MSW, LCSW, NSW-C, and MPA. Nina is a nephrology social worker for Kaiser Permanente in West Los Angeles and U.S. Renal Care of West Los Angeles, working with in-center, home, and peritoneal dialysis patients. Enthusiastic to learn about nephrology, she attended National Kidney Foundation, NKF, spring clinical meetings early in her career. She has had opportunities to co-present at the NKF SCM and the California Dialysis Council annual meeting with a focus on new nephrology social workers. During this time, Nina passed the California license in clinical social work exam and received the NKF certified nephrology social work credential. So without further ado, let's see if we can bring her on here. Nina, welcome so much. And you're going to be speaking for 45 minutes, and then we're going to do a 15-minute Q&A. So Nina, take it away.
Thank you so much for the introduction, and I will get my slides ready for everyone. Okay, so thank you so much for this opportunity, and I want to welcome everyone to this session about proactive care planning, about advanced directives. My name is Nina Abiera with 9 years of experience working with PD, home hemo, in-center patients, and part of the pre-transplant evaluation. This focus for this session is on those who have kidney disease, their caregivers, and anyone who wishes to learn more about advanced directives. Also included will be information for staff who serve these patients. And by attending this session, you're taking the first step. So as part of housekeeping, so you know what to expect, there will be a break halfway in the session, a very brief one. And at the end, there'll be a Q&A session, a question and answer session, where you will be able to message anything that comes up. And for any reason you are not able to ask a question or receive an answer, I'll leave my last slide with my contact information for you, okay? So let's begin. So what to expect in this session? You can expect to identify or start the process of thinking about what are your needs and wishes. Also, to point out where to receive more information, more education about utilizing the dialysis team for support, and to answer any questions on where to share the form and when to make updates. And again, also at the very end, I'll have a special section for professional staff who serve the patients. So just generally, taking it from a very basic level, if someone has never heard about this, don't know really how to go about it, or have been avoiding it, what is an advanced directive? That is one of the questions I hope to be answered through your attendance here. Who can answer my questions? And what to do with the advanced directive when it is done. So before starting about the advanced directive, let's go back and look at the steps before you chose your treatment modality. This decision is complex, emotional, and daunting. So you may have looked for information in the following ways. The first point person would have been most likely your doctor, because they've been monitoring you or had been the one to inform you about a decline. So that person may have recommended what is best for you considering your medical conditions. Also, you may have talked to your family and thinking about this, what type of support is available for you? Your friends, your support circle, you may be looking to see if they themselves have experience on dialysis or through word of mouth or through their own friends or family. You might want to have somebody close to you to provide that type of feedback. And lastly, research. In this day and age, if there's anything that comes into question, people might run to the computer and look on the internet. And in this case, because it deals with a type of treatment, you may be looking at videos. Or if so far that you've gone into your own search, you may be looking at that particular clinic to see what their ratings are. So once you get that information, you are communicating with those around you that you trust, you will proceed on to selecting what is your preferred way for dialysis. So that might look at first in-center hemodialysis. And this is just an example of what type of thoughts you had while considering the different options. The in-center offers that staff is available to assist. There's always someone there. For peritoneal dialysis, you may not be as interested on it because it is done daily at home. For home modalities, the idea of having a care partner, someone there to assist you cannulating your fistula, may not be something you're interested in. But as we just finished about our last speaker about transplant, that could be actually the priority for you, the first choice, because then you will no longer need dialysis. So looking at the ways that people and ways that you've received the information, then evaluating the positives, the negatives, the pros and cons of each treatment. You can use those similar skills and techniques when deciding what you would like to do for your advanced directive. And so in connecting that, what was needed was an understanding of your values and wishes. What is important? What are you willing to do? It involved a lot of communication between these individuals, these centers, doing your own research, a lot of communication going back and forth. And lastly, with that information, being able to make a decision based on the relevant education, understanding the options and the possible outcomes before making a decision. It is also understandable due to your own personal kidney decline that you may have not had the time to do this in this manner. It could have also taken place after the fact, after starting dialysis, where then you had selected, maybe I'd like to reconsider PD or home hemo. So what is an advanced directive? What does it look like? So in this one here, this one clearly says that in the very front, here's the California Advanced Healthcare Directive. Now, there are other ones out there that you may have seen. Here, this one is called 5 Wishes. It is actually an advanced directive, but verbiage, words like this may cause confusion. And here's another one from out of state, where the larger words in this form in the front is life care planning. It does say advanced healthcare directive, but just understanding that when you see a form, it may be confusing if you are stuck on the verbiage and the words that you're most familiar with. So starting back to the basics, it is important to understand the purpose of the form so you can recognize, is this really an advanced directive? Now, where have you seen it? You may have seen it during a medical appointment, a doctor's office, emergency room. You may have seen it hanging in a file slot where you wondered what it was, but you're not quite sure. By mail or email. Mail might be a little bit more outdated, but you could have received something from your insurance plan or paperwork prior to a planned surgery. Your insurance plan might have directed you to a website for more information. And lastly, because this is for dialysis patients, you may have seen it in the center. When you first started, as part of the intake paperwork, they may have asked if you already have a form or if you would like to select particular treatments while you're there. And it is a patient's right to execute, to start, to initiate an advanced directive. And it can be reviewed annually. It can be offered annually when you are part of a dialysis team, even if you're receiving it at home. Another one that is an outcome is that maybe you have had personal experience through loved ones or legal documents. You may have been the identified individual who is an advanced care an agent for someone else. or you may have actually completed one in the past and forgot about it. So just ask your dialysis center, your doctor, the hospital if they have one already in place. But you can make changes to it. But it might be helpful just as a starting point to start to remember maybe what was the motivation in the past. So what can it do? It can communicate your wishes. So this next portion is going to include an example from an actual advance directive, but you may not have an idea at all what your preferences would be. And this is why it is to your benefit to start the conversation early. And later we will talk about how to address those questions. So these are the words that are used in a particular advance directive. And to summarize it, one can select or refuse care regarding medical interventions, including tests, locations, whether or not you prefer it to be at home or at the hospital, medications, nutritions, and if you have certain options or decisions in terms of donation or an autopsy. So why start thinking about your wishes now? Well, let's think about what you may have seen or heard about other dialysis patients. Events close to us may have lasting impressions. And so questions may come up after witnessing something or hearing about an emergency taking place on the dialysis floor. Also, dialysis patients in this particular study, in comparison to their age-matched peers, other individuals not on dialysis of the same age had reported 3 times greater cognitive impairment. Now, another reason why to start this process earlier than later. And from this particular study, there was a lower completion rate. Not as many patients had filled out their advance directive, even though they were on dialysis, about only half. Also, why start thinking about this now is that COVID-19 changed protocols. In a different study, they pointed out they saw an increase in the early 6 months of 2020, where it was about 77% increase in their patient population requesting to fill out information about DNR. And we'll go over that word. It means do not resuscitate, and CPR. Also, depending on the situation and where you may be placed in case of emergency, the facility, the hospital may limit the interaction of visitors or the healthcare agent in seeing the patient. So that's going to further limit communication, even if the patient can communicate and give some input or talking to the doctors as they come in and do an evaluation. And also, your previous wishes may be outdated or have changed. And just remember, the healthcare agent is here to serve you, expressing your wishes in an event that is unexpected. You can name the representative, you can appoint one person or another in case it is your preference that someone is available as backup, in case that primary person is unable to communicate, overwhelmed by emotion. And you can also specify if these wishes are effective immediately through your healthcare agent. That's not often, but in some situations, the patients have made that preference. Now, in selecting a healthcare agent, this is a big part of your job, your work, to make sure whatever you decided, all the effort you made into deciding what you wanted is executed, is followed through your identified person. So first is who accepts the role. They have to accept it. And you don't have to assume it's a family person, a family member, and that this person is trusted. So in each section, I'm going to just give a little snippet of my experience with patients and some of the challenges in these areas. So I had a patient whose wife was selected as the primary, and the secondary person identified and third person identified were her parents, his in-laws. The reason why was that his family outside of the area was unaware of him being on dialysis. They were completely unaware. So as a potential agent, it was the wife who said, what her comfort level was. She was afraid if something were to happen, she not only have to deal with the shock of their family members knowing he's on dialysis, but very complicated decision making. So she was able to voice that before accepting this role, please look at what you can do. It can be in terms of sharing his, if he felt comfortable sharing his diagnosis, or just letting them know this is my decision, this is my wish, and I know this is what I want. So that would be something to consider, is that they actually accept it. Next would be understanding your wishes. What matters most? So this is also a big question to ask. Well, I don't know what matters most. How would I know in every situation? So you can't. You're going to do your best. But let's just start with bigger questions like, what do you enjoy doing? What brings you pleasure? What is something that you value? And for some, at this point in time, it might be, I want to maintain as much independence as I can. I'd like to be able to do activities as walking independently without having to check in with someone, just live my life. So on the flip side, that might be speaking more in terms of that, would you be acceptable of 24-hour care if needed? Or how much would you be open to pain management if that is a priority to you? Also, being able to have your healthcare agent separate what they would prefer and your wishes, because this is your advance directive. I had a patient disclose to me that he was his mother's primary healthcare agent. There was also a brother in the picture, but it's unknown if he was even listed in the form. Ultimately, his mother wishes to be at home in the event it is her end time. But the son had expressed verbally, I'm not going to let you go there, Mom. I'm going to let you go to the hospital. I want to try everything. And they actually had time to have dialogue about this. But when the time came, the son did push his agenda, which was to take the mom to the hospital. And it caused a lot of problems between him and his brother. And his brother, unfortunately, who was not in the advance directive. So going back to the first part, is this person trusted? This person had expressed to his mother already that he wouldn't want to follow her wishes, and he was unable to separate his wishes and values with hers. So this, in this case, could be a scenario if you're not selecting an appropriate healthcare agent. Understanding the role, this person is going to be your advocate. They're going to be communicating between friends or family or medical team. And so I had a individual, a girlfriend of a patient, but she was a girlfriend for maybe 20, 30 years. And when the time came for her to make a decision on whether or not to maintain him on life support, she had a lot of difficulty thinking about talking to the family. On one hand, it was because of her not being legally married, that she thought that it would be difficult to convey to the family that she was the authorized person. But she, with support from the chaplain and close friends, she was able to communicate that eventually. Now, who cannot be an agent? Someone under 18 or 19 in some states. And think of generally healthcare staff that serves you in some capacity medically, or even if you live in a boarding care, nursing home, assisted living, they are providing service to you on some level medically, so they would not be an appropriate agent. And given the examples I had discussed, it is recommended that you have somebody who is trusted and can speak on your behalf and separate their wishes from yours if they are not aligned. So what they can do for you, the advance directive, they can also identify acceptable treatments. And so when talking to your agent and your healthcare team, here are some things to consider as far as questions. You can discuss personal experiences or observations. Now, some people may have never had anyone pass away, seen CPR administered. I can speak myself before getting into the medical field, it was very limited. So talk about what your knowledge is. I know that in TV, for the most part, when someone requires CPR, there just happens to be a person close by who swiftly acts, is completely comfortable and knowledgeable to CPR, and then all of a sudden the individual is able to walk away and return to their normal life. But what if there was a delay? What if the person was not able to administer and provide help and you had to wait for paramedics? Those are the kind of questions you can have with your doctor and kind of start thinking what would be acceptable to you. What are your expectations? That's another way of just saying what is acceptable to you, your wishes. So here is an example. How would your wishes change if you were unable to remember who you are? How would you feel if a doctor said you needed to be dependent on a machine? Now you are in a unique position because dialysis is a machine, a life-sustaining treatment, a medical treatment. So with that, you also do have a choice on if there's a point when you feel that you no longer would want it, right? And what are some examples of medical interventions? You can talk to your doctor about this in relation to your own medical issues. Areas in terms of life support, I talked about it with the challenge with my other patient, with his girlfriend making the decisions. So this is taken from an advance directive here, and they label it as end of life decision. And as far as the options, there's two major ones: whether or not you choose to prolong life or not. You can also include specific requests, something outlining your religious, cultural, or personal touches. Now, the other advance directive in the example, which was called 5 wishes, they went ahead and outlined some topics that might apply to you or individuals who opt for this type. So here it asks if you would prefer to have your favorite music played when possible. Would you like to have religious readings and well-loved poems read aloud? And if there are options for hospice care to provide that level of care during your time and also for your loved ones. Advanced directive also, as we said, discussed donations. And although a person on dialysis is not able to donate a kidney, they may be able to donate other organs or tissues for research or donation. And also, don't forget that you can update the changes. So now we have gone through the advanced directive, it's a good time to take a pause, especially if this is the first time you're thinking about these questions. So if you need to stand, stretch, get some water and go for it. Next, we'll be taking a mindfulness moment for a few minutes in hopes you can use this exercise as a calming activity to address stressful situations that may come up, okay? So let's begin. Sit in your chair comfortably with your feet flat on the ground. Close your eyes. And when ready, take a slow breath in through your nose and out through your mouth. Continue with this cycle at your own pace. Feel the air fill your lungs as the stomach expands. And when full, slowly breathe out. Check in with your body. Start to relax your shoulders and let go of the tension. Continue with your breath. Slowly breathing in through the nose and exhale through your mouth. Let's do this for 2 more cycles. Slightly roll your shoulders forward and back, and start to open your eyes. Roll your neck from side to side. And hopefully that felt a little bit refreshing for you during the session and also gave you a break And remember, thanks for, taking care of yourself for this moment. And hopefully you can use this in other ways in your life, even while on the dialysis chair or doing dialysis at home. So now that we have already reviewed the purpose of the advance directive, let's take a look at who could answer your questions. You have your social worker. Today we have already gone through how do you pick your healthcare agent. But what if you don't have an agent and you still have particular wishes you'd like the medical team to follow? And who should have a copy? So there is a form called a POLST, a physician's order for life-sustaining treatment. And in this form, there are 3 general categories that is covered, where it deals with CPR. And in it, if you decline it and you do not want CPR, it's called do not resuscitate. You can indicate it here. You can also express about how much and to what level you would be accepting of medical interventions. In a similar way regarding nutrition, would you be open to artificial nutrition by feeding tubes, and for how long? Trial period, long-term, or not at all? And lastly, this is a form that needs to be done with a doctor. It doesn't have to be a nephrologist, but a doctor. And that way they will have it signed, and that will reflect a medical order, okay? So just in this slide, it's white, but usually this form is in hot pink. It stands out. So just remember that if you're being offered that, given that, to take close attention to it on filling it out. So there are comparisons between the advance directive and the POLST form. So advance directive is a legal document outlining who can make decisions on your behalf and what are the acceptable treatments. However, the POLST form is a medical order. You're doing it with the doctor. And that's something to be sure that you do, so you can answer those questions with a professional, okay? And the POLST, you're not indicating who can make decisions for you because you went ahead and did that. You already indicated what your wishes are. So for the rest of the team, here are some ideas how you can approach them and ask other questions. So for a registered dietitian, you may want to know, what does it mean to have long-term nutrition? Can you give any insight or feedback about that? For your nurse, how can my advance directive change what staff would do in an emergency setting in the dialysis clinic? Would CPR be done? You can ask them, what does it mean if you bring out a machine? What's going on there? For your doctor, it's essential for you to have these questions in conversation with them also, even if you're going the route of an advance directive. So what are examples of life-sustaining treatment? What happens to a patient? The facility administrator, you may want to know what happens in the center when someone has an advance directive. You might be interested in the process or the protocol or where it's held, things like that. For the secretary or admin in the front, you may want just to double check if your emergency contacts reflect who you would like to be on there. And if you happen to have an advance directive or in the process, if you would like those to align, because that would make more sense that the staff is not having any confusion on who you'd like to have contacted. And lastly, this is a very important person that I sometimes feel is not discussed enough on what their role is. A technician, for those in a center, sees the patient every treatment time. So they may feel more comfortable in asking questions and sharing changes that could impact your advance directive. There could be a great point person in that, asking which person can answer my questions about, so you could work collaboratively, the technician can work collaboratively with the team. So now that you've identified an agent and you've had all your questions answered, how do you go about filling it out? Well, you can do it online or have a paper form, which you can get from the dialysis center, a hospital, or your doctor. My slides also include resources if your wish is to do it independently online. And I found this great site called Prepare for Your Care. And in it, it is a step-by-step process. There are videos. So in the event your healthcare agent that you are thinking about asking is really taken back, doesn't understand, there are videos here that may be helpful in that conversation. When you are all done completing your wishes, to finalize it, there are two ways. The first is to notarize the document. You may be able to do that at your bank, what do you call it, at a hospital. Sometimes some hospitals have notary services, or paying privately through a company to get your document notarized. You also can do is, or have two witnesses sign the document. Do not sign it in any case until you see a notary or have two witnesses present. You cannot have as a witness your healthcare agent. So whoever you decided on in the front portion of it who will speak on your behalf, they cannot sign as a witness. This person also cannot be your healthcare provider, your doctor. And here on this form, it says, I do not work for his or her healthcare provider. So think of this in terms of in the same capacity at a dialysis center or the hospital. If someone is providing you services or working alongside with your provider, they cannot be a witness for this document. And also, if you happen to live in a board and care, assisted living, nursing home, or even if at the hospital, you cannot have that staff as a witness for you, okay? So in terms of when to review your wishes, during times of divorce and marriage, not only yours, but maybe through your agent, or just seeing this incident may start you to think of who would be more appropriate during that point of your life. I had a patient who I reviewed, he never thought about it, and then because it was already completed, and when we reviewed it, I said, who's this person? Because it was unfamiliar to me. He said, oh my gosh, that's my first wife. I'm already been married for a long time now, my second wife. So he quickly made changes to that, because if that wasn't caught, it would really complicate his situation. Every decade, you can think in terms of, if there's New Year's, you think about resolutions. What are your goals and wishes for that year? So for, as a decade comes up, that could be a time, just as a reminder, maybe I should go take a look and see if there's been any changes. If you happen to have had a new diagnosis, new to dialysis, that could be a time to also review if your wishes need to be updated. Death of another person, that could be your healthcare agent, having witnessed or having someone close to you pass away, reevaluating what you would want in your situation. That could be a time to review your wishes. And lastly, a major change. That could be retirement, making a move, especially if you're going out of areas. We're talking about documents. What if the document you have is not honored in that particular state or country? Getting Medicare, because that indicates to me retirement, maybe change of insurance. Let's make sure what you have outlined is still correct. Now, who should have the form? Well, you need to have a copy for your dialysis center, especially if you are receiving treatment there in center many times a week, 3-4 times a week. And even if you're doing it at home, make sure your dialysis team also has a form. Your primary care doctor, your healthcare agent, if they made decisions and you entrust them with this, it makes sense that they should have a copy too. And your hospital. And lastly, but most important, you. How many times have I heard patients say they've gone through this, they've made it, but you don't know where it is? So make sure that they also have, you also have a copy. So in review, just to kind of conceptualize this, you have the opportunity to work with your medical team, a back and forth with communication, your support system, outside resources to develop an advance directive. Again, just like when determining what type of dialysis would be preferred for you, you looked at your values and wishes. You had to do it through communication and in part of making an informed choice. So as far as patient questions, what is an advance directive? It is a form that you indicate who is your agent, and it outlines your medical decisions, your preferences. Who can answer your questions? It could be your medical team. It could be some of the research out there that will be included in this session. And what to do when you're done with advanced directive is you have to share it. You have to store it somewhere accessible and make updates as needed. So considerations for medical staff, let's take a look at their actual experience in this healthcare system and how they're able to navigate. Number one, this is a very complex system. There are 2 studies here, and in it, it's mostly done from providers, doctors from various specialties: nephrology, palliative care, primary care, vascular surgery, and cardiology. And there are 3 points identified that could be a hindrance in completing an advanced directive and really capturing their wishes. So in this complex system, a patient might have had minimal care before dialysis, maybe regular visits with their primary care doctor, to maybe an all of a sudden decline in health where they had to have services through the emergency room. If they were informed of it, they then might have urgently been referred to different specialists, places for labs, places to see, which might pose other problems across town, unfamiliar processes. And sometimes these providers, I would actually say more times, would be automatically assigned to them. So patients in the midst of all of this are unaware of what are their choices, what can they do? They're in the shock of finding out that they have a kidney decline. And another thing is that there's a lack of shared understanding. Some settings may perceive another one is taking the priority, is taking the lead in having these advanced directive conversations. And in that, it might be viewed as more of a task. Let's say, what is their status as far as CPR? We just need to make sure we have that on file. While others see it as a conversation. Even though getting the information which is helpful for knowing the patient's wish in terms of CPR, we may be not able to capture other things that is just as important, such as what would the patient like to do in terms of dialysis? Well, is there a point when they no longer would see it as beneficial? Unclear responsibility is, for example, in the dialysis center, there is something called for the conditions for coverage, which dictates the regulation and mandates for dialysis centers to follow to ensure quality standard of care. So these are what we call the V codes. And in summary, it basically stating that the whole team, the interdisciplinary team in a dialysis setting, must be familiar with the advanced directive and have access to these documents. Some patients may expect providers to initiate the conversation. And again, providers may expect that other ones are having these conversations, or while they might have the forms available and completed, there's no steps or mechanisms of who's going to update, who's going to check in to see if there's been any changes. Not all providers felt it was their responsibility. And as an example, when a person sees that there's a decline in their health and their kidney function, it's usually the doctor who takes the lead. When it comes to advanced directives, that's not always the case or belief. And lastly, a lack of active communication. So it was also found in one of these studies that a lot of the patients and their families found it difficult to even start this discussion with their care team. And patients expected them to start it, but professionals may be reluctant and be fearful of upsetting the patients and their family. So active collaboration and communication around advanced healthcare planning between providers caring for the same patients may be lacking. And staff also may be unsure if they are appropriate to be the ones to initiate it. However, this is a large system problem. This is a lot of aspects and moving pieces and players in there. So here are just some suggestions is to address it. And one would be to address a complex system is to first look at our own companies that we work for. is there company support in this effort, facilitating meaningful collaboration with the IDT and develop a shared understanding and a role of an advance directive to address their experience. Also, to address the lack of shared understanding, then training is definitely needed. It's needed to address concerns, even for the professional staff having these conversations, optimizing their skills, and aligning with their goals, the goals of the patient being able to express their wishes. With unclear responsibility, the hope would be to clarify the process and looking at the workflow and how the IDT can collaborate. This is, I know, another level that's more about maybe management and the company support, but the hope is that we can move away from the idea that it's not my job or I don't know how. And creating dialogue to encourage active communication. So move away from the idea that this is difficult for all patients, that all patients would be uncomfortable discussing it. Utilize the strengths of the dialysis clinic and staff to communicate when changes have taken place, there's a decline in health, and even if their living situation has changed. You may be able to reach out to others, such as a nursing home, hospital, other places where the patient lives and they provide some level of care, or they may already have the form, and that way you can hopefully get a copy and also discuss with the patient if this is something that still honors what they would like at this time. So for medical staff, think of some questions for the patients to start this conversation. Let's take a look at how patients come to decisions overall. Does the patient highlight or have a point person, let's say when it comes to care plans, or do they take in all of the decision making themselves? Also, looking at their own particular personal beliefs. How does their religion or culture affect those conversations? A patient may feel that talking about an advance directive brings about unwanted feelings or news about the end of life. Also, some may feel their faith is enough and that they don't need to put it down in writing. And talking about relationship with providers, that's really pinpointing if they have a distrust with providers overall, with the healthcare system. Patients sometimes have said, question, what is your motivation for asking about this? What do you get out of this? And others may believe that it is the doctors, the providers who are the experts and defer to any decision-making to them. We've talked about this before, is when is stopping dialysis your choice? And what type of words are acceptable or preferred in this discussion? So the whole team can participate in the conversation. In this presentation, I'm moving away as it being more task-oriented, but having opportunities to talk about it so the patient can really truly have a tool that was going to be helpful for the healthcare agent, for themselves, and for those who are serving them in case it is needed. So who else can benefit from an advance directive? And I would say that everyone can. And that is why we can continue the conversation. So for patients, you know, in doing this, not only are you going to be able to share and gather some information about what you want, what your healthcare agent is willing to do, you can also normalize this process and what is the function of this document, the advance directive. And in the form of earlier, I pointed out that sometimes keywords can lead to the confusion. And in my session here, and I will talk to Carol about sharing this, as an example, healthcare agent might be referred to as a proxy, advocate, surrogate, representative, durable power of attorney for healthcare. So again, these can be confusing. And so I'll have this here as your reference. And again, just you having the knowledge and understanding of what is the purpose of the form is such a great start with this. These are some resources if in California or in other states you'd like to initiate advance directive. Here are some planning tools, especially if you're having some challenges, or you'd like to involve the healthcare agent in your decision making, interestingly, be sure to talk to your medical team in your state or country to see what are the actual acceptable forms, okay? And April 16th is actually the designated day called the National Healthcare Decision Day. So we talked about reviewing this every decade, and now there's a day actually dedicated to hopefully remind patients, remind everybody, not just patients here in dialysis, to start thinking about it. These are the references for studies and other things mentioned in the session. And right now, so this is the end of my talk, my presentation. If there's anything after the fact that comes to mind that you'd like to ask, please feel free to send me an email, and I'll leave this here. And the rest of the time is available for any type of questions or concerns or comments. I will take a look in the chat now. Oh, thank you, Mr. Mark Headland had a question about what's the relationship between a will and an advance directive. This is a great question, going back to the verbs, or excuse me, the words that might cause confusion. So a will can encompass not only health, but financial. So that's a very general word when we hear will. So a living will may actually include things that are covered in an advance directive. But if I were to just hear will, I'd have to clarify with that individual who says, Nina, I have a will. I would clarify, is it regarding finances or health? And from there, you can use it because they, a living will does cover or has the opportunity to cover things regarding your medical care. So thank you so much, Mark.
Is there anybody else that has any Q&A for Nina? Wow, that was fantastic. Thank you so much. Gosh, a lot to take in, and just to simplify and do what you did. Just fantastic.